So I'm Dr. Tom Murphy. I'm a Associate Dean for Health Policy here at McGovern Medical School and Chief Medical Officer for our community-based clinics. I am a practicing family physician and continue to see patients on a day-to-day basis, many of which have actually had COVID-19 over the past 12 to 14 months. The pandemic has unfortunately wrought a number of things upon us. One obviously is the severity of the disease, which has affected the entire country. But on top of that, there has been a secondary problem associated with it, which is the delay in routine and periodic health screening for much of the population. From the very outset, we saw patients that were hesitant to come into the clinic, into the hospital for their routine annual health examinations, including screening tests such as mammography, colon cancer screening, lung cancer screening, and routine lab evaluations. That became apparent very early on in the pandemic. It was probably some fear initially due to the reluctance of patients to access public spaces or spaces that they potentially viewed as public where they could be infected. At least initially at the beginning of the pandemic, there was a lot of uncertainty as to how the virus is spread, whether it was on surfaces or on foodstuff, on doors, etc. And a lot of that anxiety and fear translated into patients not wanting to access medical care at all unless they deemed it extraordinarily emergent. It certainly is safe and has been safe for a number of months. We are clearly aware of how the virus is transmitted, and with the increasing number of patients that have been vaccinated, we are rapidly approaching what is called herd immunity in Texas and certainly in Houston in general. So the social distancing, the wearing of masks, the increased hand washing techniques, and of course, on top of all of that, the critical importance of vaccinations has really lessened the risk dramatically of patients being infected in medical offices. Primary prevention has been a critical aspect of American medicine and healthcare for many, many years. Early detection of asymptomatic disease and early intervention has been critical to actually change the curve and trajectory of many of these completely preventable bad outcomes for many of the diseases that we're seeing. So, such as vaccinations, we've known for a long time that without vaccinating the population, for instance for children with measles, mumps, rubella, chickenpox, etc., the outcomes are very bad. So that's been a clear understanding and widely accepted for children. The same thing applies to adults, vaccinations as well, but also health screenings for early detections of cancers. We know that within the first 6 to 10 months of the pandemic, that there was at least 6.5 million women in America that delayed having a mammogram. Expectations are that hopefully most of those women will ultimately have a mammogram, but expert sources suggest that there's going to be as many as 10,000 additional breast cancer cases, many of them quite advanced, over the next 5 to 10 years. Immediate problems that have been associated with the pandemic: in the year 2020, there was 11% more deaths due to heart disease than there were in 2019. That's really an unprecedented increase, and clearly due to patients' reluctance to come in for health screenings, for blood pressure evaluation, and for early symptoms that could have been actually addressed at the time instead of turning into large symptoms and fatalities. There's a number of sources, including the Lancet, which produced a very good article a few months back that estimates that because of delay in patients having colonoscopies, that over the next few years there will be a 5 to 10% increase in advanced colon cancer cases. The same thing applies to patients that have delayed periodic screening for lung cancer, which would be the smokers in the population. Really, delayed care is denied care. It's better to be evaluated and have your periodic health screenings done now rather than wait for next week, next month, or next year. Most likely your evaluations are going to turn out to be normal, but very commonly there's going to be abnormalities detected that we can intervene early rather than later.